With more than 380,000 confirmed cases worldwide, one thing is clear about the new coronavirus: it is very good at infecting people. Now studies are starting to reveal just how infectious it is, and when a person with COVID-19 is most likely to spread the virus. While we know some people are more vulnerable to the virus than others, it is capable of putting a healthy adult of any age into a critical condition and in need of intensive care. However, the virus can also be asymptomatic, causing no noticeable illness in some people. Such cases were first recognized in China in January. Science China Life Sciences, doi.org/DQBN, but it wasn't known how common they were. Research published last week by Jeffrey Shaman of Columbia University in New York and his colleagues analyzed the course of the epidemic in 375 Chinese cities between the 10th of January, when the epidemic took off, and the 23rd of January, when containment measures such as travel restrictions were imposed. The study concluded that 86% of cases were undocumented, that is, asymptomatic or had only very mild symptoms. Science, doi.org/GGN6C2. The researchers also analyzed case data from foreign nationals who were evacuated from the city of Wuhan, where the first cases were seen, and found a similar proportion of asymptomatic or very mild cases. Such undocumented cases are still contagious, and the study found them to be the source of most of the virus's spread in China before the restrictions came in. Even though these people were only 55% as contagious as people with symptoms, the study found that they were the source of 79% of further infections, due to there being more of them, and the higher likelihood that they were out and about. If somebody's experiencing mild symptoms, and I think most of us can relate to this, we're still going to go about our day, says Shaman. These people are the major driver of it, and they're the ones who facilitated the spread. A project in Italy has also found many symptomless cases. When everybody was tested in a town called Vo, one of the hardest hit in the country, 60% of people who tested positive were found to have no symptoms. That is lower than the number found in China but is in the same ballpark, says Shaman. It might be 1 in 10 in some societies versus 1 in 5 in others, but generally you're looking at about an order of magnitude more cases than have been confirmed, he says. For most people who do fall ill, symptoms are usually mild and develop slowly, according to the U.S. Centers for Disease Control and Prevention. While many have heard that a cough, fever, shortness of breath and fatigue can be signs of COVID-19, the condition's symptoms can also include a runny or stuffy nose, sore throat, headache, muscle pain, diarrhea, nausea and vomiting. Of those who get ill, 19% enter a severe or critical condition, usually with pneumonia. The mortality rate varies depending on a number of factors, such as a population's average age, the state of a country's healthcare system and the extent to which mild cases are identified and counted. A study last week estimated that 1.4% of symptomatic cases in Wuhan died. Nature Medicine, doi.org/DQBQ. It is rarer for children to develop serious disease, but it is a myth that young, healthy adults don't. There are some young people who have ended up in intensive care, said the UK government's chief medical advisor, Chris Whitty, at a briefing on the 19th of March. Once someone is infected, the incubation period is usually between 2 and 14 days, with half of cases showing symptoms before the 6th day. Annals of Internal Medicine, doi.org/DPH3. However, this was calculated by studying 181 confirmed cases, meaning it is unlikely to have taken very mild and asymptomatic cases into account. Even people who develop symptoms are at risk of unwittingly spreading the virus. A study in China suggests that infectiousness starts about 2.5 days before the onset of symptoms, and peaks 15 hours before. medRxiv, doi.org/DQBR. We know that coughs and sneezes spread the virus, so how is it possible for asymptomatic people to spread the infection? People with mild or no symptoms can have a very high viral load in their upper respiratory tracts, meaning they can shed the virus through spitting, touching their mouths or noses and then a surface, or possibly talking. Even people who don't feel ill occasionally cough or sneeze. Once symptoms develop, a person's viral load declines steadily, and they become increasingly less infectious. However, people appear to keep shedding the virus for around 2 weeks after they recover from COVID-19, both in their saliva and stools. medRxiv doi.org/dqbs closing parenthesis. This means that even once a person's symptoms have cleared, it may still be possible to infect other people. Airborne droplets are likely to be the main infection route, but contaminated surfaces could play a role too. Health advice typically says the virus can persist for about 2 hours on surfaces, says William Keevil at the University of Southampton, UK. But a study published last week suggests that this is a serious underestimate, with viable virus surviving on cardboard for 14 hours in plastic and stainless steel for up to 3 days. New England Journal of Medicine, doi.org/ggn88w closing parenthesis. It can also hang around in the air for at least 3 hours. Survival of coronaviruses for days on touch surfaces is a hygiene risk, says Keevil. It is difficult to avoid touching contaminated objects or surfaces such as door handles and push plates, bed and stair rails, public touch screens, etc. There is also some evidence of transmission from feces to the mouth, says Elizabeth Halloran at the University of Washington, which reinforces the importance of handwashing. Keevil recommends regular, rigorous handwashing or using an alcohol hand gel, and avoiding touching the eyes, nose and mouth. The latter being extremely difficult because humans are tactile and touch their faces many times an hour, he says. What all this makes clear is that advising only people with a cough or fever and their families to self-isolate won't prevent the coronavirus from spreading, thanks to its fiendish ability to cause very mild symptoms in people, and to peak in infectiousness before people even realize they are sick.